Good morning, good morning.
Good morning.
Thank you all for choosing to be here rather than in bed. I'm sure it's a tough choice on a Sunday morning after the festivities last night. So my name is Rubin Naiman. This is I think my 20th year here at the Narcolepsy Network, and it's always a pleasure, a delight, a learning experience for me to come. I am a psychologist and a sleep and dream specialist. I've worked in the field of sleep and dreams for about 40 years. I began developing alternative perspectives on sleep and dreams in 1990, opened the first sleep center outside of a hospital in the US at that time at Canyon Ranch, a health resort. And subsequently, I've been working with Dr. Andrew Weil. Some of you are familiar with his work. Dr. Weil is the founder of Integrative Medicine, and today we'll be talking about integrative sleep and dream medicine approaches to narcolepsy. If they don't take my coffee away.
I'm getting cues over here.
And I'm delighted today to have Andrew Cunningham, Andy Cunningham, who's a physician who introduced himself along for this. We're going to be doing some presentation, we're going to share a few points, and then we're going to open it up for some dialogue. Okay.
My name is Andrew Cunningham. This is my first year here. I'm really thrilled to be here amongst a lot of people that have common interests and experiences as me. I feel like after being here now that it would have been great for me to come earlier in my life and meet more of you guys. I'm a primary care doctor. I'm board certified in family medicine and also integrative medicine. I live in Denver, Colorado, and do a sort of a mix of different types of work. I don't have a private practice. I do a combination of virtual primary care, mostly from my home there, and have been interested in integrative medicine really since the beginning of my path, learning about health. And the reason that I'm here is sort of because I met Rubin about 10 years ago when I was doing an elective in Arizona, learning about integrative medicine when I was in medical school. And I should mention importantly here that I have narcolepsy. I was diagnosed with narcolepsy my first year of college. And at that time, my sleep doctor told me, this is what you have. I was like, great, now I understand why I fall asleep and have been, more or less walking through a dream for so much of my life. And he said, you'll be on medicine for the rest of your life. It wouldn't be safe for you to drive without being on medication. And that was the perspective that I lived in for a while, but I, at the same time, was studying natural ways of treating a lot of other diseases, and always kind of wondering if there was a more comprehensive way of thinking about my own subjective, sense of illness. And so we met about 10 years ago, which sort of changed my perspective on how I thought about narcolepsy, and we'll talk about that a bit today.
Great. So let me just say a few words about integrative medicine, what it means. Essentially, integrative medicine is about bringing together the best of conventional medicine, what we typically think of as medicine, and complementary and alternative medicine, which includes whole medical fields like Ayurvedic medicine, traditional Chinese medicine, homeopathy, but also it historically has involved a lot of focus on nutrition, which conventional medicine has largely ignored until recent years. So we bring all that together. Probably one of the most important features of integrative medicine, again, in contrast to typical approaches to medicine, is an emphasis on body and mind relationship. We emphasize the point that there is a neck, right? There's a connection between body and mind, and that the mind has a very powerful influence on the body. And as a psychologist, is something that I found very compelling when I joined the Center for Integrative Medicine. In contrast, because I'd worked in medical arenas for years, in contrast to those, there was such receptivity to really understanding how powerful the mind is in impacting health. And one last point I'll share about integrative medicine to begin with is that we make a distinction that's often forgotten in healthcare. It's a distinction between what we call disease and illness. So by definition, a disease is something you can measure. You can apply numbers to it. You can look at the number of white blood cells under a microscope on a slide. You can count, you can measure a fever, you can count this and that. So a disease is an objective, scientific, observable measure of being sick. It's typically what we think of. Illness is the feeling of being sick. It's the subjective experience of being sick. And you might think at the outset that they go hand in hand, but they don't. About 50% of people, of patients who show up for outpatient primary care doctor visits, show up with illness. They feel sick, but there's no detectable disease. Now we can say that's psychosomatic or prodromal or preclinical, it hasn't shown up, but actually it's something else. It's the emotional experience, and we'll go into this in a little more depth. So there's no overlap in that. It's also possible to have disease without having illness. And the classic example I like to use of this is, for those of you who remember Mel Brooks's film Young Frankenstein, anybody remember that? You remember the good Dr. Frankenstein arrives and he meets Igor, right, the hunchback? And at one point he says to Igor, I don't mean to boast, but I'm an excellent surgeon and maybe I can help you with that hump. And Igor says, what hump? Right? So again, a silly but good example of having disease but not having illness. And we'll move more into this notion as we go along today.
You can talk about Mindbody and go ahead.
I'm sorry, what?
Well, one thing that I wanted to mention as we kind of as a sort of a transition from the keynote yesterday was one of the things that was brought up that many of us have heard over the our learning period about narcolepsy is about an autoimmune component and what does that mean? That term is sort of loaded. Most people realize that it means that our body is attacking itself or something like that, and there's probably recognition amongst this group, because there is among the greater public, that autoimmune disease is on the rise. It's sometimes people talk about it being an epidemic sort of fluctuation right now, and what I was always told was that there's a genetic component and then there's some kind of environmental trigger. And for a long time after I was diagnosed and started to explore this idea that narcolepsy may have an autoimmune component, I kind of wondered, what is the environmental trigger? A lot of my interest currently is in studying gut health and autoimmune disease. And part of my renewed interest in following the research in narcolepsy comes from that. And I just want to sort of explain that autoimmune piece in a little bit more detail that might give people better context. So does anybody know the word epigenetics? Have people heard that term much? Okay, so what that means is that that our genes are not determined the way that our genes are expressed are not sort of written in stone. Our environment affects our genome. So genetic susceptibility to something is a susceptibility. There are other variables there that determine whether or not certain genes get expressed. So those other components are the environment and our immune system. So for me, the most interesting area of medicine right now is this sort of deeper understanding of how the immune system works, how the microbiome influences the immune system's communication, how environmental health and our current state of environmental poor health is having an impact on the health of humans. So that is a passion of mine. I follow microbiome research closely and sort of the emerging ways of treating autoimmune disease in more natural ways. So if people have questions while I'm here over the course of the day and about microbiome, gut health, that kind of thing, that's sort of the resource that I want to be, is to be able to, try to give you answers to what I've learned about those things.
Great. Just to go back to Andy's comment about epigenetics, we know that one of the critical categories of factors in epigenetics is psychological. What we think, what we feel, our belief system has a profound impact on how genes are turned off or turned on. So one of the things I want to emphasize, and again in connection with this notion of illness, I want to encourage you to begin paying more attention to your thoughts, your feelings, and your beliefs about various aspects of narcolepsy, of what it means. Most of us buy into models, and the models are scientific and objective, and they're extremely useful in understanding populations, large groups of people with diseases. But they do not give us information about our personal relationship, our illness around having narcolepsy. So what I'm actually talking about here is something commonly referred to as mindfulness, to become much more aware, tune into your personal reactions, your personal thoughts, your personal beliefs. In integrative medicine, for years, we've talked about something called medical hexing. And it is just as it sounds, medical hexing. Often, again, in the name of good treatment, physicians will tell doctors, well, you have this disease, and this is what you can expect. This is sort of the natural history of the disease. This is going to happen at this time, you're going to need this medication, so on. And what they're describing is what we've learned about groups of people, but never really about you as an individual. And medicine is moving in that direction, but we want to encourage you to tune into yourself. More important than the disease or an illness a person has is who the person who has that disease or illness is. So very commonly with regard to narcolepsy, and I've worked with many, many people individually, there's a sense of shame associated with it. It's very hard to avoid that, particularly if you have cataplexy or just you're falling asleep, and you're falling asleep in social settings or falling asleep on the job. It's really important to note how you react to that. It's essential to work on suspending judgment. This is the first step in the process. To notice the judgment, you need to notice the times, the moments, the situations which trigger judgments, self-shaming, anger, fear, depression around it, withdrawal around it. So you want to begin to notice that, and that will open up just this incredible realm of possibilities about having a different kind of illness with this disease that we call narcolepsy. Part of this is about becoming mindful of your body, really tuning into the body. And in our world today, so much of what we consider health practices involve beating the crap out of the body. There's the old notion of no pain, no gain. And a lot of people, in the name of health, in the name of stamina, in the name of longevity, really are harsh with their body. Actually, I want to share a quote from one of my favorite writers about how to relate to the body. This is from Hugh Prather, and he says, most of us have a more balanced sense of how to identify with a dog than with our body. We love our dog today, but we can't love our body because we are waiting for it to be different. Free of the anger that comes from unreasonable expectations, we feed our dog a good, simple diet. We exercise him and we bathe him and take him to get his shots. We keep him away from dangerous situations and gently decline to give him everything he wants. There is no war in this relationship. There is no war in this relationship because there is neither neglect nor a battle for perfection. A sane approach to questions about diet, exercise, sleep, and the like is If my body were my beloved pet, what would I do? So this speaks to another trend that we're seeing today that I think is so critical in healthcare, and it's a trend around self-compassion. Self-compassion is a natural state. We see it in children, even in animals. It's a state that arises naturally if we suspend judgment. And the only way to suspend judgment is to become aware of it.
Yeah, I'll speak to my own experiences a little bit from that perspective. So around the same time that I was in my training, sort of in the thick of having pretty severe narcolepsy symptoms, I don't have cataplexy, but I pretty much slept through, my teachers started to tell my parents that I was sleeping in class when I was about 9. And then pretty much slept through high school, a lot of med school. I remember falling asleep in a one-on-one interview in one of my medical school interviews, which is like shocking that the person didn't even acknowledge it. It's that...
They may have been asleep too.
Right. But somebody was saying yesterday, I think maybe Molly was talking about how when you wake up, you don't know like how long you've been gone, right? Was it 5 seconds or 20 minutes? And when you're in a one-on-one conversation with somebody sitting down in a hot room with low light, we've all had that experience, those of us that have narcolepsy. Around this same time in my life, I started to become more interested in mind-body practices and meditation and yoga nidra. If that's something that anybody has been exposed to, is an interesting thing that I wanted to bring up. It's you may be able to speak a little bit more to it, but it's a practice that encourages doing body scanning and body awareness, like body scan type meditations to move yourself into a deeper state of sleep that a lot of us probably are more familiar and have quicker access to than a lot of other people. But I 100% agree that engaging in some kind of body awareness or mind-body practices can help us gain a bit more of a sense of control of what we're feeling in those slippery situations. I also want to sort of speak to that idea of everybody having a different subjective experience of narcolepsy. I think it's a spectrum, right? Just as I think a lot of conditions are. I mean, most of life is a spectrum. There's not a lot of black and white. There are a lot of gray areas, and recognizing that different life conditions, different life stages, different environmental inputs may move us along that spectrum. So it's nice to sort of uncouple your thoughts from, is there a cure for this? Or will this medicine make everything go away? Or will this particular diet just, completely resolve my narcolepsy or something? That's maybe not the most valuable way to think about it. We try to get incremental gains, and when we in integrative and functional medicine, we think about, all of the different inputs on a matrix that can impact someone's overall health. So, paying attention to the diet, the ritual, and the routine. This is echoing what other people have said, and I think a lot of people have recognized over time, but I can't speak to it highly enough, that in my life, the times that I've been able to overlay more ritual and routine are the times that I've felt like, I'm the most sort of well-adapted version of myself as I can be. For me personally, like a couple people because this is the first time I've ever been here, and a lot of people probably haven't met very many doctors with narcolepsy, I get this question like, how did you get through school doing that? And I see a lot of nodding heads. People kind of wonder. I mean, it was a struggle, I pretty much did a lot of self-learning, so I was reading a lot and trying to learn outside the classroom, because being in a dark lecture hall is not a favorable place to take in new information when...
Like this?
Yeah. Yeah, if anybody falls asleep, you can... I got these glasses last night. You can just put your glasses on and we'll think you're awake. Or if anyone needs to borrow mine. So what I was saying is, I encourage this I've had a handful of patients with narcolepsy over the years, and one of the beautiful things about that is what I've learned from them, but I learn from everybody that I see in the office or that I interact with in sort of a therapeutic relationship kind of way between us. And I always encourage people to sort of step out and try to see things in a different way, because it's easy to catastrophize illness or, think about like, oh, well, I have this thing, so I can't do that. I think it's important to always sort of be open, recognize that even our own experience of narcolepsy is going to change as we age. Our immune systems change as we age. People have allergies that just disappear. People have hives that occur for, regularly for a year at a time that just all of a sudden disappear. Why is that? It's because, we live in these dynamic bodies that are changing all the time, and our environment around us is changing all the time. So a lot of what we are trying to encourage here is, a perspective of hope, optimism, positive reframing. I mean, this has been sort of critical for my ability to transcend through a lot of challenging stages of my own life and dealing with, trying to succeed and having narcolepsy. I had another thought, but I'll stop there. I can't remember what it was exactly.
I like your comment about positive reframing. Narcolepsy is an amphibious condition. Narcolepsy is an amphibious condition. What I mean by that is people with narcolepsy can live in two different states, more so than others. Amphibious beings can live on land and water, they're back and forth. If you think of the water in this metaphor as the state of sleep and dreams, people with narcolepsy live very close to that, and often they're in and out, in and out. So one of the questions that's so interesting to ask is, when we are not here, when we are not in ordinary, normal waking consciousness, where are we? Where are we? The presumption is that being here is what it's about, that this is real life, being awake, right? Being productive. And I'm not arguing against that, but I want to suggest the possibility that there is as much life going on underwater as there is on dry land. Where do we go when we're absent from waking? Because there's so much struggle. For so many people, it's as if they're being dragged, they're being suddenly kidnapped and pulled out of life. And so the way to move into this and to open your minds and hearts is to consider more mindfully, to just suspend your judgment about where you go. Suspend your judgment about sleepiness. Suspend your judgment about dreams. Suspend your judgment about cataplexy. And consider, instead of kind of hanging on to the doorway that you're being pulled through into sleepiness or dreaminess, look at where you're going. And what I want to strongly suggest is that our common understandings in this world of what sleep is and what dreaming is are way off the mark, We've learned both from a scientific perspective and from what I'm going to call a spiritual perspective, looking at sacred writings that go back thousands of years. We've learned from Tibetan Buddhism, from Hinduism, from Advaita Vedanta, from Kabbalah, from many mystical traditions, that there's another way of understanding what sleep and dreams are about. And science is just beginning to catch up with that. So I'm suggesting that the best way to really learn this is to look at it in yourself. One point here is there's a common assumption that when you're asleep, you're unconscious. And that is simply not true. Being asleep is a different kind of consciousness. And since most of us believe it's unconscious, metaphorically, when we're pulled into sleep, we kind of close our eyes. We stop being aware of. And we have ample literature now, even scientific literature, studies in yoga nidra, which is basically sleep yoga, that shows that we can actually learn to be aware. You can actually experience, you can be conscious of sleep. It's an unusual kind of consciousness. It is imbued with a profound sense of serenity. But I just want to make the point that there's something there, that sleep is not simply the absence of being waking. It's not like you're being whisked out of normal waking life and locked up in some dark space somewhere. There's something in there. And the second point, which I think all of you know, is there's also something in the world of dreams. And again, today in the Western world, in Western medicine, dreaming is commonly considered irrelevant. It's considered sort of this accidental experience that happens at night. These dust clouds are kicked up during nightly neuro-housekeeping. But I want to suggest to you from many other perspectives, contemporary psychology, archetypal psychology, and older spiritual perspectives, that there's something in that world, in your world of dreaming, that's worth exploring. So you're not just being taken away from one world. You're not being imprisoned and deprived of real life. You have an experience, you have a potential for experiencing a whole other realm of life. And the best way to do that is to just stay aware, suspend judgment, and stay aware of what's going on inside of you. If you don't mind, can you hold, and we'll finish with our comments soon, and we'll open it up to discussion. Thanks.
To those points, I just wanted to talk about how when I did start to think about things and with more interest into those in-between gray states and everything, you start to learn about some of the more creative thinkers in history and different strategies that people have for accessing states of creativity. And most people can identify experiences they've had of having sort of unlock the pieces of a puzzle when after you've gotten up and you're just in the shower, or going to the bathroom, or just something like that, where you're sort of maybe not quite awake, you're in that groggy state. There's been some research done recently about the value of thinking about something that you need an answer to before you go to bed, and how it's not uncommon at all for people to wake up with sort of a solution to that. And for me, I want to speak a little bit to sort of how there is actually overlap in, I think, my interest in integrative medicine and different ways of looking at health, and how narcolepsy has influenced that, because it's an unconventional, I went to medical school in Kentucky, that, it was very sort of Western, conventional teaching, and I have used, I think, that closer permeability and thinner ability to get into those different conscious states as a deep well of creativity over time. If somebody comes to see me with difficult to treat multiple conditions, and I'm trying to think about okay, what is the overall picture? How do I see this person more holistically, and try to figure out what approaches may work to move the needle for them. Probably some of those realizations come to me when I'm not sort of sitting there in a black and white conversation with them. I have to kind of, maybe squint my eyes and sort of think about their way of being in the world in a different way. And it's interesting, this is sort of touching on that, people using altered states to get into deeper places to tap into their creativity. I mean, the classic shamanic way of people doing health, in more native traditions, is for healers to sort of move into different states to get information to help, bring communication from ancestors back to people that are present in front of them, just determine ways to help those people. So I feel like it is such a precious thing to have easier access to this creative well, and have found that, the more I've embraced that, the more it's actually been kind of positively rewarded for me in my career, as now I'm doing a little bit more brainstorming about different ways to deliver care to people and educate folks and writing and things like that, it comes up continually that, you know, people come to me when they need sort of an out-of-box perspective, or they want a creative way of looking at things, or want some feedback that they might not otherwise get. And I sort of feel like narcolepsy has helped me, you know, have a different way of looking at things.
Great. Well, let's open it up. Questions, comments, discussion.
Do either of you have any readings that you'd suggest that helped you that you would want to share?
Probably to this sort of more mind-body perspective, I can't think of anything right now. I mean, I have read a lot. I do really enjoy reading about kind of different, like there was a book I read long ago, probably, that I think maybe helped me realize that I had narcolepsy. It was about conscious states and different states of consciousness, you know, and that kind of made me think, oh, like maybe my way of thinking about this is different. Well, for me, I can transition a little bit to talking about my interest in gut health. I wrote an article about celiac disease and non-celiac gluten sensitivity for a company that I work for. And is it okay? I can go ahead and just talk about and my experience with this and how I sort of ended up here was, you know, I mentioned earlier that I have learned a lot from patients over the years and feel like that, you know, that relationship that's created can be really fruitful. And I had a patient about 5 years ago that told me, he came in, I thought he was there for a refill of his new Vigil, and he said, I actually don't really need it anymore. I've done some reading and I eliminated gluten, and I found that you know, my need for being on medication has changed. That, you know, turned out to be a very pivotal conversation for me. That day I eliminated gluten from my diet. And what I noticed, and one of the things that I wanted to encourage in this group is within a few days, you know, my gut sort of normalized. I didn't realize that I had any gut symptoms. I just thought it was normal to go to the bathroom a few times a day. And within a few days, I was like, wow, I guess I have IBS, or I have gut problems. I'd been tested for celiac disease, and I didn't have celiac disease. So you know, several weeks later, I started dropping days. At the time, I was taking Provigil every day. And I just started trialing some days, like, I'm not going to take it today and see what happens. And I more or less don't take medication anymore. And I do continue to not eat gluten. And I know that because I spoke about this being a spectrum, I think, you know, there is a subset of people within this group, and I know there are some folks among here who know each other and talk about the experience you've had from eliminating gluten from your life or eating a low-carb diet. So I guess what I'm saying is, I think it's really valuable to experiment with your diet and the timing of your meals. And a lot of, you know, what has influenced my thinking on all this is just the developments in gut health and the developments that are emerging about autoimmune disease, the microbiome. You know, it's not as simple as if you take probiotics, then your microbiome is in good health, and then, you know, everything else is going to go away. Everybody has a very unique gut microbiome. We're trying to figure out which bacterial strains are associated with different conditions. How do we encourage, you know, growth of those populations? How do we discourage growth from the pathogenic populations? Intermittent fasting is pretty, among integrative medicine providers who do a lot of autoimmune disease, there's a lot of enthusiasm about intermittent fasting and the effects it has on gut biodiversity within the gut. So some of the more inspirational personal things for me have been learning about, you know, gut diversity, the fact that just celiac disease is not the only manifestation of gluten sensitivity. It's well confirmed in the medical literature now that there's an entity called non-celiac wheat sensitivity, which is more likely probably than celiac disease to have extra intestinal manifestations. So those, you know, by extraintestinal, it means that some people will have joint pains, some people will have coordination or balance problems, some people have fatigue. There are a lot of different ways that it can manifest. So because our immune systems change all the time, I think it's valuable to periodically look at your diet and say, is now a good time in my life maybe to do an experiment where I eliminate something for a little bit? Is now a good time in my life to think about, how I do meal timing? If I have something that requires a lot of cognitive attention, might I feel better if I just don't eat before that, or just eat, high-fat protein snack, something like that? So yeah, I'm really fascinated with everything related to the developments in those areas right now.
I would add to that. If you're interested just in an overview of integrative medicine approaches to narcolepsy, I have an article in Sleep Review. It's available free on the internet. It's called Integrative Medicine Approaches to Narcolepsy. It's not terribly technical. The other thing I would recommend, in line with what I was talking about, a way of sensitizing you to the nuances of this altered state of amphibious consciousness, is to reread some of the work by Carlos Castaneda. How many of you are familiar with that name? Okay. He was an anthropologist who worked extensively with a shaman from Mexico, and it'll take you into a really beautiful other universe of understanding what consciousness and dreams are about. Actually, we had a question up here, sir.
Oh, yeah. When you talk about dreaming, now, how does one recognize the fact that when you wake up, that we don't remember the dream? Or if we want to remember the dream, to sort of find ourselves solving what the dream meant? Because then once you wake up, it's gone.
Okay, so if...
Some. Well, because he did made a comment that I'm an electrician by trade, so I'm thinking of a problem, and then I don't know what to do when I'm asleep. It comes in, and I solve it.
Yeah.
When I wake up, then I know what to do.
If you're having trouble remembering your dreams, the simple solution to that is linger in morning grogginess. Don't chase the dream. Don't look for it. Just linger in grogginess, and it will come to you. It'll start to come. When it does, morning after morning, bridge that experience to waking life. Journal, write about it, talk about it. And over time, you'll be opening a channel, a portal between the night dream world and the waking world. Many people with narcolepsy have the opposite problem. That channel is wide open, and the dream is just gushing in, and waking is coming into the dream world. Yes?
Two questions. With the gut, I've been listening to Tim Ferriss.
A little louder, please.
With the gut research, I listen a lot to Tim Ferriss and like a lot of podcasts that talk about this a lot, so I'm really into it. But can you recommend there's two things. Can you recommend like a database where we can go and find a good doctor that kind of has the same like belief system that you kind of work with the same approach as you do, but in our area? Or are you willing to work with people like over the internet with the whole gut? Because I would like to have that analyzed and just see where I'm at right now. And I would like a good resource to find a good doctor. Because sometimes you can find doctors who are like, yeah, we'll look into your gut, and they're not really like on the same.
Yeah, it's...
They're looking at it from an integrative, they're looking at it from a medical. And then my second one was your background, or maybe people you've been exposed to who have explored like ayahuasca retreats, things like that. Because I do think it's important when we start to like embrace what narcolepsy, the hidden talents that we're given, the empathic. Yeah. So.
Can you take the first question? I'll take the second.
Sure.
Like microdosing and
Okay.
maybe ayahuasca.
Andy's going to take your first question. I'll take the second.
Okay, so there are a couple ways to find people who practice integrative medicine, right? All of this sort of gut microbiome interpretation and advising and stuff. There are really like a handful of docs that know a lot about that. I mean, it's in short supply, right? There are about 2 or 3 companies that can do gut microbiome testing for you, right? Where they send you a kit, you know, put a little stool sample in there, send it off, and then get a report finding. And a lot of times the interpretation that you get from the company that does the testing is pretty thorough, right? It's going to have sort of referenced, this is what your diversity looks like, these are your dominant populations, these are the associations that those have. A lot of what I'm trying to learn right now is like in the primary research among microbiologists, what have they, you know, seen about how different bacterial strains taken orally, do they actually like stay, you know, populated in the gut and that kind of thing. But if you're looking for integrative medicine doctors, the AIHM, which is the American Institute, or the American, I guess it's the American Board of Integrative and Holistic Medicine, is one place where you can find providers. The Institute for Functional Medicine is where you're going to find a lot of people who have more extensive training in gut health, because in functional medicine, the gut is pretty much considered to be like the key to a lot of, you know, chronic health management. So that's ifm.org, is the Institute of Functional Medicine, who does a lot of medical training for professionals.
Can I interject something?
Yeah.
So I was looking for an integrative specialist in my area, but I didn't want to pay out of pocket. I wanted my insurance to cover it. So I took the list for all of those from those resources that were in my area and cross-referenced it on the website for my healthcare, and was able to find 2 doctors in my area that are primary care physicians, things like that, that also do integrative nutrition and medication. And so I was able to actually get my insurance to pull in and cover it. There's extensive testing and a lot of things, and it can be expensive out of pocket, but there are doctors in most of the metropolitan areas that are doing dual coverages like that. So cross-reference with your healthcare.
Yeah, I would add to that, the Center for Integrative Medicine, where I work in Tucson at the University of Arizona, we have a website. We've trained over 1,000 fellows, 1,000 doctors, mostly around the U.S., and there's a map there, and you can just pinpoint where you are and pull up names. The other thing is there are a number of nutritionists, really well-trained nutritionists around the country who focus on this. Just to get back to your question about what I would consider alternate states of consciousness, whether it's using ayahuasca or other types of psychedelic experiences. You might be aware, or some of you might be aware of Michael Pollan's last book, How to Change Your Mind. Anybody familiar with that? Okay. If you haven't read it, I encourage you to. There's been ongoing research on psychedelics, LSD, psilocybin, a whole range of them. And the data today is extremely promising. You mean in linear time, yeah? We don't deal with that here. The data is really promising. You know, our center, the Center for Integrative Medicine, had a conference in San Francisco this past April where we had 1,000 practitioners. And the theme that emerged from that is the new psychiatry is psychedelics. Now, this is not about just a flagrant sort of partying approach. These are medications, and they've been proven to be potentially really helpful. I think of narcolepsy as a kind of altered state of consciousness. Honestly, I know it's incredibly challenging for people. The challenges come primarily from the collision between narcolepsy and what I consider a very sick culture that we live in, where people are driven and the expectations are just horrific, really. So narcolepsy can be redefined, re-understood as an altered state of consciousness, and it raises questions about the potential benefit of studying that with the use of varying substances. But be judicious about it. This is not something you want to play with. Hang on, there are other folks who haven't asked questions, if you don't mind.
The author you just mentioned.
Michael Pollan.
Oh, Michael Pollan.
Pollan.
Yeah, How to Change Your Mind. Yes.
I appreciate that you've talked about that our sleep state is an important part of our life. And I think the medicines that we're given for narcolepsy often only focus on our wake state and keeping us awake. I would like to know your thoughts on kind of the common medications for narcolepsy and how they impact our sleep. I'm one that doesn't tend to remember my dreams, but I still know it's important. But a lot of the medications I've taken have really impacted me. I've had horrific nightmares. Then I start remembering dreams for other medications, and then others, cause me to wake up and be freaked out, or some I feel more creative on. I'm just wondering, and then also the medications that suppress REM that are used. I know a lot of them do, and
that concerns me.
Yeah.
So your thoughts on that?
Let me just comment. Number one, there are alternatives to medication. There are alternatives for managing cataplexy. I have worked with a small number of patients on cognitive behavioral approaches. We can actually teach you to initiate cataplexy and become mindful of it and manage it and prevent it. There are ways of tuning into it. Most people, when they get an initial aura, they react with fear, panic, judgment, rejection. They tighten up and it worsens it. So there are ways of learning to manage cataplexy, certainly other alternative ways of managing daytime sleepiness and ways of dealing with nightmares. The most commonly used psychiatric medications in the US and around the world interfere with REM sleep. And in my mind, this is a very critical issue we have to address. Doesn't mean that they're not useful at times, but I believe that they're significantly overused. And there are what we call oneirogens. They're substances that actually promote healthy REM sleep. The best oneirogen that I'm aware of is melatonin. But having said that, it's not so simple. It's not about going down to Whole Foods and buying a 5 milligram thing. You really need to get informed. Much of the melatonin on the market comes from China. It's of poor quality. So you want to use it in an intelligent way before you do.
What brand would you suggest then?
Catch me afterwards.
One comment about gut health.
Mm-hmm.
I have learned more about gut health from a chiropractor than I have from any medical doctor.
Yeah, I think, we get knowledge where we can find it, right? I mean, I was discouraged from sort of learning some of the things a little bit by, the straighter, more conventional teachers that I had along that path. And, for me, it was really important for all of my medical school path to, I traveled to India, China, Arizona, a lot of places.
Exotic places, huh?
Yeah, basically to stretch my boundaries of understanding of health and different ways that people think about it. And if you learn a lot from your chiropractor, then that can be a good place to learn. Yeah. Go ahead.
Both of you mentioned yoga styles. What were they again?
Yoga Nidra?
Yoga Nidra, yeah.
And Nidra. Nidra means sleep. It's a yoga. I think it's a wonderful thing for people with narcolepsy to do because it's one of the ways of practicing mindfulness, really coming to understand the nuances of what sleepiness and sleep are about. Yoga Nidra, and it's commonly offered in most communities around the country now.
So a resource for Yoga Nidra, I use Epigenetics and there's like a bunch of different Yoga Nidra presentations you can use.
Yeah, speaking of that, so Karen Brody actually has a book called Daring to Rest. It's a modern adaptation of Yoga Nidra. She actually just moved to Santa Fe, so you can go up and invade her place after the conference. But the name of the book is Daring to Rest, Karen Brody, B-R-O-D-Y.
While we're given resources, I'll just mention real quickly, if people are more interested in sort of the updated, research about gluten and celiac and non-celiac wheat sensitivity and all that, not as how it applies to narcolepsy, but I wrote an article for, I work for a company called Galileo Health. So if you go to galileohealth.com, there's a resource page that has some health information articles, and there's one about celiac and gluten sensitivity if people want sort of strong references about the emerging research in that.
Thank you.
Thank you, guys.